Well, good morning, everyone, and thank you so much for joining us in the Switzerland Seminar Series. Today, this is our second series of the year, and we are really excited about the presentation that Dr. Mulloy has for us. And I'll introduce her in a few minutes, in a few seconds, but I would like to just make a few announcements before we start her presentation. First of all, if you are able, please share your name and the name of your organization, the organization that you represent in the chat box. And I'll take this opportunity as well to point out that you may see in your menu, it's the fourth from the left to the right, the fourth option from the left to the right for Q&As. And you can place questions there that we may answer as at the end of the seminar, but also all the way to the right where it says more, you will see the ability of selecting a chat there. That's how your chat box opens. And you can use that at this moment to share your name and the name of your organization. It's really great to hear from all of you always. We are always very excited about learning who is joining the seminars and who we are talking to. So thank you so much for doing that. Additionally, I'd like to invite you to register for our upcoming seminars. And once I'm done with this introduction, I will place a link in the chat. You will see that we have two exciting opportunities. Tomorrow, actually, we have an extraordinary seminar in the sense of it's not our monthly seminar, but it's beyond that. And it is a joint virtual convening presented by both our center, the Mary Ann Switzerland Center for Environmental Health, and the Schubert Center for Child Studies. And researchers parts of the COVID-19 and child care study will be sharing lessons learned during the research. I think it's going to be a great and exciting opportunity. So I invite you to register. I will also place a link to the registration in the chat after this introduction. And in March, we have smart materials for healthy building environments. And we also invite you to register for that seminar. Finally, I'd like to introduce Dr. Karen Mulloy. She is an associate professor at Case Western Reserve University School of Medicine. Her research focused on the development, evaluation, and integration of environmental health sciences into the curriculum in graduate and postgraduate education, with a focus on the links to environmental justice, social determinants of health, and population health. Dr. Mulloy, thank you so much for sharing your knowledge with us, and the floor is yours. I will stop sharing my slides, and you'll be able to share yours.
Great. Yeah, thank you so much. Let me go ahead and share my slide and make sure everyone can see that. And that's hopefully will do well. So I want to thank the Switzerland Center very much for inviting me to share with you some of the work that we've been doing in the medical school to introduce more topics about environmental health sciences, but specifically now on climate health. You know, climate health endangers human health through destabilizing the ecological and social systems and affects the social and environmental determinants of health. You think about clean air, safe and adequate supplies of drinking water, sufficient and safe and nutritious food, and secure shelter. The 2018 Lancet Countdown report, which monitors the impacts of climate change on health, concluded that many of the global trends identified in its 2015 report, things like vulnerability to heat and vectorial capacity for diseases and poor food supplies, have really accelerated in terms of the impact of climate change on health. And as you can see from the pictures that I included here, all recent pictures of things that are going on in the world. And so the effects of climate change are here. 24% of the global deaths and 23% of global disability adjusted life years are attributable to environmental risks as of 2016, probably a little bit more than the 24% at this point. And nearly a quarter of global disease burden could really be prevented by reducing environmental risks. The World Health Organization estimates that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year due to things like malnutrition, malaria, diarrhea, and heat stress. The health risks and impacts of climate change are not equally or equitably distributed across people, community, or nations. Some of the smallest and least developed countries are bearing the largest burden of harmful effects of climate change, despite the fact that their contribution to the problem is small compared to the contribution of large and industrialized nations. And as you can see from this map, and it's a little bit old, 2011, you can see the industrialized nations are contributing most of the CO2 emissions per capita, whereas places like the sub-Saharan Africa and places in Asia and South America contributing the least. But when we see who is being impacted by this, we can see it's the sub-Saharan Africa and places in South America and the South Pacific that are bearing the brunt of the burdens. I will point out that that these will be closer to the red because of their developing and industrialized countries, China and India, China being the #1 emission for CO2 at this point, and India being #2. And when we think about vulnerable communities, and especially when we think about this country, we think about people of color, low-income communities, indigenous communities, immigrants, people who are not fluent in English. And how are we going to address these? We're talking about people who live in rural areas that are extremely affected by climate change. And then thinking about what we've learned, obviously, even through COVID, the higher levels of existing health risks when compared to other groups put them at higher risk. Not having access to healthcare service, having uninsured individuals, not having universal healthcare in this country, people who have limited availability to information and resources because it's not in their native language. And then we think about indigenous communities, when we think certainly about places in Alaska or the northwest corner of this country, about communities that rely on their surrounding environment and natural resources for food and cultural practices and income, and that's all being disturbed by climate change. And then obviously the less ability to relocate and build after disasters. But solutions are not equitably distributed either across this world. You look at the top 2 pictures here. This is Lagos, Nigeria, and you look at the people who have the ability and the income and power to protect themselves against rising sea levels in that country, whereas opposed to the folks that end up living in Makoko, which is a suburb or outskirts of Lagos, and are being highly affected, as you can see, by rising sea levels and living on water at this point. Or you look at Holland, who's able to build these massive delta works to protect themselves from sea surges to the inland communities of Holland. But then you compare that to Tuvalu, which is a South Pacific island, who is expected to be underwater in less than 50 years. And they, of course, have been demanding of their more rich neighbors like New Zealand to do more to help to protect them. Climate change and health inequity share the same root causes. What we consider the climate drivers. Those are big systems: energy, transportation, land use, housing, food and agricultural practices, socioeconomic systems. And climate change disproportionately impacts the health of low-income communities, communities of color. And addressing the climate change and health inequities really requires a transformational change in our systems and communities. And as you can see, be thinking about, where are we going to put our interventions, thinking about these intersections between the social determinants of health and vulnerability. And of course, in our country, most of it has the core roots to systemic racism in our country and causing the health impacts to be different within communities. The impacts of climate change with more frequent and intense extreme weather and climate-related events are already being felt in communities across the country and are expected to continue to damage infrastructure, ecosystems, and social systems that provide the essential benefits to communities. The climate change impacts a wide range of health outcomes, and this slide illustrates the most significant climate changes we're seeing now: rising temperatures, more extreme weather. Let's talk to the people in Texas, huh? And rising sea levels and poor air quality. And their effects on exposures and the subsequent health outcomes can result in these changes. And as you can see from this great slide developed by the CDC, we're thinking about all of these things rotating, because we know that there are feedback loops between things like air pollution and extreme heat, and then thinking about severe weather and the water quality impacts that we've seen recently. So all of these affect and have these feedback loops that make things much worse. But you know, numerous medical and health associations, governmental and NGOs noted importance of preparing medical students to understand how to address the effects of climate change on the health of individuals and populations and communities. The AMA in 2008 adopted a policy supporting that training. And then in 2015, during the UN Paris Agreement, the Health Educators' Climate Commitment was a pledge to ensure that the next generation of health professionals is prepared to effectively address the health impacts of climate change. The deans from 118 health professional schools from across 15 countries committed their schools to training. In the US, more than 30 deans of nursing, medical, and public health schools took part in a White House roundtable during the Obama years on climate change and health, with the commitment to, quote, ensure that we train the next generation of health professionals. But what are we doing in our curriculum? Well, in 2013, a survey found that 34 to 40% of each year's graduating medical students during the years of 2000 to 2013 believed that their institution in environmental health their instruction in environmental health was really inadequate. The Association of American Medical Colleges, or the AAMC, supports a database in its curriculum inventory. And there was a query of that in 2018, and researchers found that schools really did not report any explicit inclusion of climate change education in their curriculum. And then the Global Consortium on Climate and Health Education at Columbia University conducted a survey from 2017 to 2018. It was sent to the primary contacts at 160 member institutions across the world. The response rate was about 84 of the 160 institutions, about half, and half of those respondents, or a little bit over actually, 63%, said that they did offer climate health education. 23% of those were from schools of medicine from around the world. So what is the rationale? What do we have to convince our deans about what the rationale is? Of the 18 hottest years on record worldwide since record keeping began in about 1880, 17 have occurred since the year 2000. Temperature rise and greater frequency of extreme heat events will place a significant health burden on the global population. Currently, about a third of the world's population is exposed to lethal combination of heat and humidity conditions for at least 20 days per year. And I'm talking about lethal as opposed to, gosh, it's hot and it feels kind of humid. These are really lethal combinations of the type of humidity and heat that will be happening in various places in the world. And projections really indicate that that proportion of the world's population with such exposures will increase anywhere from 48 to 74% by the end of this century. The 2018 Lancet report concludes that based on the analysis of the data, climate change is the biggest global threat of the 21st century. New data of the cardiovascular and pulmonary impacts of air pollution are of particular concern, because climate change potentiates the damage caused by air pollution, while conversely, air pollution accelerates climate change. The Lancet Commission on Pollution and Health, air pollution was implicated in about 6.5 million deaths in 2015, and only increases with each year since. But what about the healthcare institutions themselves? Well, you know, the US healthcare sector itself contributes to US greenhouse gas emissions at approximately 10% per year. If the US healthcare system were a country, it would rank 13th in the world for greenhouse gas emissions. And so we have a lot to do within our own house. And healthcare systems really oversee medical care of large segments of vulnerable populations experiencing the health impacts of climate change. And then we need to teach this because it fosters necessary critical thinking, participation in global health and sustainability initiatives, multidisciplinary perspectives, because physicians will not do this by themselves, and a real public health literacy. And these are all essential physician skills in a rapidly changing environment. So what do you think the barriers are to adding climate change to curriculum? And here are a few: lack of funding, staff time, competing priorities, maybe skepticism, maybe lack of teaching materials. Why don't I go ahead and I'm going to ask you to participate, and we'll launch a poll and ask you to go ahead and pick the top 3 challenges that you think are barriers to trying to institute climate health curriculum in a medical school. And I'm going to give you 30 seconds to do that. So we're about there, 20 seconds. So I'll give you another 10 seconds to vote. Okay, let's stop the voting and let's look to see what your votes think that our biggest barriers are. What do we need to overcome? So let's see. So competing institutional priorities, very interesting, and our politics. That's very interesting. So that certainly is a real concern, and certainly is something that we look at a lot within looking at new curriculum. But close behind that is lack of availability of staff time, maybe lack of funds, and no available support. So that, okay, great. We'll go ahead and close that. And let me show you actually what the actual the global consortium survey said. So from around the world, it was really lack of availability of staff time, which really links in with kind of funding and time to support this development. Competing institutional priorities came next with politics, no available space, time, and core curriculum. And then this is probably one of the bigger ones that we faced here at Case Western. And then really great to see kind of worldwide that there was a very low lack of interest or demand from students, and very low, fortunately, administrative skepticism that climate change really did exist. So great to see on that. So, Case Western University, fortunately, recognized the importance of including climate change in our curriculum. So how do we approach designing the curriculum? How do we go from a content-focused design to a results-focused design? The backward design process described in the Wiggins and Tye book, Understanding by Design, is a concept that seems sometimes counterproductive at first, because most educators approach the planning process by first designing the learning activities. Students, I want you to read this chapter, and then I'm going to test you on that. That's kind of that's one approach that people take. But in contrast, the backward design really begins the process with designing the student's assessment as the most effective way to help students understand and not simply store knowledge, some scattered facts. Wiggins and Tye differentiate understanding from knowledge, and understanding implies that students read a proficiency in which they can describe the concepts through their own interpretation, can view the information through multiple perspectives, have empathy, and reflect on their knowledge. So we begin this method of designing an educational curriculum by setting goals before choosing the instructional method and forms of assessment. So we start off with this big ideas. What is it we want students to understand? What are the big ideas or possibly skills that we want them to come away with? And then how are we going to assess them, that they've actually got these big ideas? And then we'll design what learning event fits best with both of these. So, And just as concepts can be used as organizing ideas, backward design also includes the identification and development of enduring understandings to align the curriculum. So we have to align the curriculum with the whole medical school curriculum. And enduring understanding really refers to transferable big ideas that have lasting value beyond a specific topic. They really involve abstract ideas and really require inquiry. They're not specific to a topic being studied, but can infer to the discipline being studied. And so what we started off with was some big enduring understandings that we wanted to be sure that the students would finally grasp. That social and environmental determinants are inextricably linked to health, and that all populations will be affected by change. Change can mean lots of things, lots of topics there, but some are more vulnerable than others. And then you narrow it down to the topic that you actually want to cover that will help them understand these enduring understandings and actually link some of the other disciplines to those. And so with topical understandings, we talked about understanding the environmental factors such as temperature extremes and weather extremes and be important determinant of health, and that understanding all populations will be affected by climate change. That's our change we're thinking about, but health risks and impacts are not equally or equitably distributed across people, communities, or nations. And then you go to your learning objectives, because how do we figure out what people understand? Well, they understand because we use active verbs to have them describe the impacts of climate change on human health, with emphasis on vulnerable populations. And we have them identify environmental factors and how it affects the social determinants of health. And then for our one about the populations, explaining how adaptation mitigation strategies can reduce adverse health impacts of climate change. So this is what we first developed. But how are we going to introduce these complex topics in the already overcrowded curriculum? So we have to go back then to be thinking about adult learners. Medical students are young adults, but they're still adults. And what we know from research is that adult learners learn approaches to solving problems. That's what they like to do, not just learn facts in isolation. They want to learn as need arises, so just-in-time learning. They want to be able to use it. They want to go at their own pace, develop their own learning objectives, but they really want to know how well they're doing. They really want some feedback to that. And so what we know is that information in isolation is unhelpful. Teaching should attempt to integrate new information into an individual semantic network. In other words, their previous prior knowledge. So research from cognitive science has shown that the sorts of skills that teachers want from their students, such as the ability to analyze and think critically, requires extensive factual knowledge. So you have to have that base. You can't think creatively about information unless you have information in your head to think about. Without any information in our brains, we tend to see new facts in isolation, non-contextual ways that lead to shallow thinking. As you can see from the depiction of Bloom's taxonomy as a pyramid, it really acknowledges that very important principle. You can't get to the top of this pyramid without having this solid base. But we don't want to also we don't want to just stick in the solid base, having people spew back facts that they didn't learn how to analyze and apply and create with. So this is all part of that to lead up to that pyramid. So Case Western Reserve University School of Medicine curriculum has long been recognized and praised for its innovative approaches. And in 2006, the School of Medicine launched the Western Reserve II curriculum, known as WR2, to develop a learner-centered and self-directed curriculum framework and implement a dynamic small group learning teams. But introducing complex topics into an already crowded curriculum can be daunting. Medical schools education is often really compartmentalized into departments and disciplines, and it's overwhelming by an ever-expanding knowledge base. Let's just even think about what we've learned and have to teach our medical students this year about the new COVID virus. So you just think about this ever-expanding knowledge that we have. And really, I think that the barriers at Case Western have been really worked at trying to decrease that and increase the amount of cross-disciplinary work in that. And they really adopted that in thinking about all aspects of environmental health, and now have adopted that for climate change. The best way to introduce climate change, complex topics we had really felt, was keeping with the student-centered learning. The instructional strategy really is what's known as team-based learning. So what they do is out-of-class preparation. So they were assigned readings about climate change, health effects, links to social determinants of health, and a population and public health response. So they do that out-of-class preparation, and then they apply it during class in these small groups, in these team-based learning sessions. And so what we decided to do was our instructional strategy then for our first 2 learning objectives was to do a concept map. And that was a bit innovational. Usually team-based learning has been, as our second instructional strategy was a case presentation with small group discussions. They come and they're given 4 answers. They have to decide which their group, or which answer that they think is the consensus answer of their group. All of the groups vote on it, and then they reveal their votes. And then the groups will debate with each other about why they chose one answer and didn't choose another answer. And that's a classic TBL. But we decided what we really needed to do was to be thinking about having students actually see the concepts of how these, all of these terms and thoughts about climate change interact with each other and how they interact with each other. And so we chose this instructional strategy in 2019. So we said, use the first 4 issues related to climate change. That's rising temperature, extreme weather, rising sea levels, and air quality, what we're seeing nowadays. Create a concept map. It's a visual organization to represent knowledge. And we said, show your concepts and ideas and the relationships among them. Connect climate change and the social determinants of health, environmental and health effects to that. We gave them big sheets of paper, lots of markers, and set them at work. They also had a YouTube to watch about how to create a concept map, since that was a new concept for them. And we gave this example of what concept maps look like, and when you're looking at specific topics. So let me share some of the concept maps the actual students did that year. As you can see, this group did a great job of thinking about coloring, and so looked at each of the 4 areas that we were asking them to look at, and they did the environmental effects, the health effects, and social effects. And as you can see, linking all of the things together, really putting in the middle here the issues about all of them contributing to mental and emotional distress. But as you can see, the disruption of social networks and poverty and economic burden, thinking about the large social issues to that. Here's another group that, again, they were really putting stress totally, that thinking that all of this causes tremendous amount of stress. They were thinking really about they framed it in their minds about individual population. And then I really liked to think about kind of planetary health, which is really nice to see. And then they thought there were lots of mortality because of all of this. But again, thinking about displacement, scarcity, collapse of economy. So thinking about the big social issues related to this. And then this other group really thought, very clearly about, specific issues, and thinking about the health inequities, thinking about refugee crisis. We know that we've already had refugee crisis across the world because of climate change, and it will only get worse as climate change gets worse, resulting, and we've seen this in sub-Saharan Africa and the Middle East, issues about war because of climate refugees. And then obviously the pandemic disease. They were pretty dystopian. They kind of thought about mass extinction here. Anyway, so there's kind of give an example of kind of the student creativity. And they actually had about 15 minutes to create this, 15 to 20 minutes to create this. So we thought that was pretty good. So here's the second part of the TBL, and this is really a more classic TBL, which is climate change case. And so this is the case. In 2018, a heat wave in Cleveland sent many patients to the Metro Health Emergency Department. The Commissioner of Health for Cuyahoga County is preparing to submit a plan to address the health and equity issues of rising temperatures due to climate change, obviously in Cleveland and Cuyahoga County. And your team has discussed the issues and had decided to submit the following suggested interventions to the Commissioner for inclusion in her health plan. Select the best plan. Be prepared to justify why the plans you did not select are not as good as the one you selected. You may use your team's concept map to help in your discussion. And so then they're given 4 possible plans that were created by the faculty. And with TBLs, there's always good things about all of the answers. And usually it's a consensus answer by faculty, which way they think may address the most important points. But there's no kind of right answer. It's part of the teaching for medical students to know that there is some, everything is not black and white. There's, especially in medicine, and there's a lot of gray out there. And you have to be thinking critically and applying that base knowledge you have to being creative at the top of that Bloom's taxonomy pyramid. Okay, so here are some answers, the answers that we gave them. So the answer A, plan A, your group is concerned that the commitment of resources to heat wave preparedness will lead to reductions in other public health services. There is a finite budget that health departments have. Things like child immunization, HIV prevention. They want to establish accurate and timely warning systems with heat-related information and collaborate with the emergency medical services and train police and firefighters to recognize heat-related illness in vulnerable populations, and they could take advantage of the funding for immediate services to the community. Plan B said your group needs to improve data about vulnerable populations. Good data, very important. And health and social inequities, and use it to planning and prioritize climate and health programming. Important step is to design and conduct surveillance on climate-related health impacts, identify vulnerable populations, work with diverse partners to reach that population more effectively. Plan C, your group will host a summit or workshop to talk about climate, health, and equity connections and provide a structure for community and stakeholder input, very important. We want everybody at the table. And they want to recommends the use of the community-based participatory research or citizen science, and some qualitative methods like surveys and interviews to identify the indicators of climate and health vulnerability in your data collection and interpretation. And Plan D said your group recommends that the citywide interdepartmental work group be organized and form a citywide team with community residents and groups and organizations to develop a comprehensive strategic plan, thinking about land use or transportation, and design, support the design of a healthy, sustainable, equitable communities, institute evidence-based plans, and thinking about expansion of prevention and treatment options. So I'm going to give you a minute to kind of start to look at those, read them, think about it. Pretend you're a group, you've discussed this with your group, and you're going to decide on which plan your group is going to vote for. So I'm going to give you a minute to look at these. And if we had more time, I would break you off in groups and have you debate it, but I'm afraid we don't have as much time as we wish we could. So you can kind of debate within yourself. Okay, so now we're going to put up the plans and we're going to think about it a little bit more, and I'm going to give you about, almost another minute to decide on which one that you really wanted to vote on. Which plan? Okay, so that's about 45 seconds. So let's see, why don't we go ahead and stop, and hopefully you've all had a chance to vote. And what's our decision? Okay, so let's see. So we kind of had almost equal between Plan B and C, and a little bit, not quite a half, but about the 45% that thought that Plan D was better. So and so this is the part where students have to, in their groups, have to stand up and they have to defend their answer. What was their critical thinking about why they chose Plan C? And they would say, I would choose Plan C. It's important that we have all of our stakeholders and all of our community groups be involved in this from the very beginning. We think that the more people we get involved in citizen science, the better we'll be educating the whole population. So they would defend their answer, and then they would say, why they didn't say that. And they, I didn't choose Plan A, although we are extremely worried about budgetary effects. We do have limited budget. This is, because they've already had a lecture about this, this is only, unfortunately, downstream solutions. And not part of the upstream solutions to this. So this is something they've already read about, something that they learn how to apply and do that. So great job, guys. So good. And so so let me go ahead and. So the consensus answer of our faculty was D. So as you can see, we decided that we really wanted this work group citywide, all kinds of residence groups. We can get all kinds of folks involved in this and do that. And then we go on to not only kind of reveal it to them, have them discuss, why we did that, but give them some background and thinking about, we have to have interventions to address climate change and health inequities. And we need to range from upstream structural policies and system changes. So thinking about systemic racism in this country, and specifically in Cleveland, how we have to address that, and all the way to downstream. So treatment, rehabilitation, maybe disaster recovery efforts, plans, thinking about that. We have to have both of those things. But when we were balancing it about kind of the feeling that we needed to be addressing things, very clearly at this point, the upstream solutions have the greatest benefits because they really provide primary prevention. And they've already had lectures about the primary prevention versus secondary prevention versus tertiary prevention. So this is building on all the lectures, all of the other activities that they've done to help them actually apply it and actually be able to verbalize why they apply it. So we've asked them to be thinking about, verbalize about primary prevention. And so this is the discussion that we had. And then we talked about urban resilience. What does that really need? And what the true resilience means is that rethink urban systems that supply energy, transportation, food, water, housing. We're going to have to be very creative. And we have to live within planetary limits and avoid further destabilizing all of our natural systems and eradicate all of the inequities that magnify vulnerability to disaster. So that's the truly about true resilience. So those were kind of the take-home messages that we wanted them to think about. So a quantitative and a qualitative four-item survey with one open-ended question was administered immediately after this session, seeking feedback from students, because this is the first time that we had this with the students. And the survey used a 5-point scale where 5 was very effective and 1 was very ineffective. And 3 questions addressed the effectiveness of our learning objectives. And one question was on rating of the effectiveness of actual TBL facilitators. We want to get the students' feedback on how well the faculty did. And so that was one of them. But I want to really concentrate on the learning objectives. And as you can see, we had a pretty good response. We had about 53% of the first-year medical students completed the survey. That's pretty good. And then here's the results, the percent and the mean of students who indicate the session was effective or very effective. Those are the two things we want, 4 or 5. As you can see, we're about 74% describing impacts of the conditions with emphasis on vulnerable populations. 72% identifying environmental factors of climate change and how it affects social determinants, but only 53% in explaining how adaptation and mitigation strategies can reduce adverse health impacts of climate change. So this is the actual thinking about how do you apply the concepts in thinking about adaptation, solutions, mitigation. You know, what are we going to be thinking about as health professionals in the future? So that was the one we really thought about a lot. Here are some of the folks that responded. The students responded, 98 responded, about 47% responded with some written comments. And there was, some themes, valuable experience with building a concept map, which is great. They'll be doing more of that throughout their careers, because this is all taking place in the first 5 weeks of medical school. So this is, they'll be using concepts map more. They like being able to collaborate with classmates, important thing to build professionalism. And they love this autonomously, including climate change in the curriculum. And what could be improved? Again, so thinking about that last lower score, increased depth of climate change topic and concrete strategies is what they thought about. And here's some actual messages that they did. Very valuable to have a discussion surrounding climate change and health, especially as it pertains to exacerbating existing social determinants of health and structural inequities. I really love that we have climate change. TBL is such an important topic, but not always discussed in a healthcare setting. Exclamation point, nice. And then here's the parts about improvement. More time could have been spent on how local public health departments can mitigate downstream effects of climate change and address upstream drivers. I enjoyed the group activity, found it creative. However, I wish there was more focus on mitigation and more conversation on the intersection between healthcare, climate change, and politics. So what did we do then for 2020? We took that to heart, and we decided that we would expand using the concept map and not use the case presentation. And so we gave them a little bit more background besides all the readings that they do before they actually come in to the TBL session, and talked about that endangers human health through destabilized ecological and social systems, have them start to be thinking about that, and thinking about climate change effects, immediate risks like heat waves, or indirect risks like changes in ecosystems, or diffuse risks like stress, and global health risks like conflict and increased refugee displacement. Again, but we wanted them to explore the drivers of climate change. So think about the big systems. Remember, housing, energy, transportation, the big systems, and their relationship to the 4 big problems that we're seeing now. Unfortunately, since it was 2020, they couldn't be in person, so they were all in their on Zoom in their breakout rooms. And they created a concept map on Jamboard, which you can draw on in the breakout rooms. And I wanted them to connect the drivers of climate change, so starting to think about those systems a little bit deeper, the 4 issues of climate change and the relationship to environmental health, human health, and social determinants of health. So here's one of the ones sorry. And here's, sorry. And then the second part, so they created their map, came back, discussed it, everybody presented their maps, then they went back again to their breakout groups, and then we said, using the concept map, discuss the ideas of adaptation, mitigation, strategies, and/or solutions. So we wanted them to have that discussion in their group, not just answer a question in a case like the classic TBL. And how could it reduce the adverse health effects? And we wanted them to actually map into the map, where does it fit? In other words, if you're going to come up with a solution, tell me, where does that impact in this cascading effects that we see with climate change? So here is the map that one of the groups did. You can see they put the big issues about systems in black: electricity production, fracking, industry, deforestation, that's land use. So thinking about that, how that increased the greenhouse gases, cascaded down to climate change, end up with extreme weather, and then end up with, as you can see, kind of they ended up linking all of these facts back to existing social inequities, but thinking about certain occupations, having exposure to climate risks. For example, we're seeing chronic renal failure in Central America among sugarcane workers, linked in the last number of years to a variety of things, but partially because of increasing heat and humidity. So an exacerbation of asthma. So all of those issues. And then when they went back, and you see this is pretty busy, so they were pretty clever, and they shrunk this on Jamboard, and then they started putting all their solutions in around that. And as you can see, they really thought about where would it intercede. And so we ended up having, the hydrochlorofluorides here, and the policy changes and global coalitions could really make an effect in here. Plant-based diet. So because of big manure waste in the kinds of agriculture we have in this country as a huge methane emitter. So they were looking at more plant-based diets and things. I really like this, thinking about the existing social inequities, educating girls in family planning. So thinking about things like reproductive justice. So they really worked at trying to think, where could we end up getting some solutions or some mitigations to that. But unfortunately, we're unable to report an evaluation on this TBL because of the 183 students class, only 24 completed the post-survey evaluation survey. Unfortunately, because of lots of changes, because of having to have everything online during the first 5 weeks of medical school that happened, we had to do this all rapidly, changing this, this TBL was in the last year during their exams, and that's all they were thinking about. And so we really could not complete a good valuation to provide an adequate sample to adequately evaluate the session. So we're hoping, obviously, they're going to do that again this year and get a better sample for that. But one last thing I'd like to share with you is that I actually did this as a beta test with my Introduction to Environmental Health class for the Master of Public Health program. And this group of students in the class actually constructed this beautiful map of thinking about the drivers of climate change and how they swirl around, causing increasing gases, and then causing all of these rising and great color coding, can you believe it? Rising temperatures, sea level rise, poor air quality, and extreme weathers. And then thinking about, where are our solutions? What are solutions? It to be thinking about policy changes. So that's down in here, and mitigation, discover alternate methods for cooling. So this is thinking about again, rising temperatures, and this would be out here. This would be a mitigation adaptation, but is not getting at the drivers. So thinking we have to do both, but why would we do that? So great, just wanted to share that wonderful map with you. So I will want to say I have acknowledgements that I really could not have done the work without Drs. Wilson DeFalce and Dr. Galat for their mentorship and their helping to create this climate change curriculum. And then the center, the University Center for Innovative Teaching and Education Learning during the year, when I was learning about backward design and learning about enduring abstracting thoughts. I was a fellow with the U site, and Drs. Garrett and Davis did wonderful feedback for me on that. And I will say our curriculum did win from the Case Western University a 2020 Scholarship and Teaching Award for the innovation. And so, any questions or comments on that? And I will stop sharing my scene so I can hopefully see you or maybe see people in that. And are there any? Do we want to?
Hey, thank you so much for this wonderful presentation, Dr. Mulloy. I think it has made me think a lot about my own medical training in med school. But we have one initial question from Kathleen Pagan. Uh, she writes in the Q&A box, "Hi Karen, wonderful discussion. Do you think med students come to medical school with a pretty good basis on the basics of climate change from college? Maybe why they wanted more on mitigation and politics?"
Yes. So I'm glad you asked that question because we wondered that too. We didn't know. So in year 2019, many of the comments that we also got back was some of the readings were pretty basic. We already got that. They kind of gave a lot of us feedback to us that, oh, you don't have to convince us about climate change, and we understand the basics. We've been reading. We really want to learn, these really, how do you do policy changes? How do you think about communities? How do you involve them? How do you think outside the box? What about big systems? So, so from 2019, we really found out very early on. They had the basics down, and they really wanted to delve into the deeper parts of it. And so for us, thinking about curriculum across the continuum, and even across that first 5 weeks, in the first 5 weeks of the medical school at Case Western is called Block 1. We teach population health, vulnerable population, disparities, structural racism. We teach all that background information. Block 2, they now go down to the cellular level and learn the cellular level. So all of you physicians who are listening in, they're like, oh, that's how I began, the cellular level. And then it wasn't until later I figured out the cells were connected with people. We start out at Case Western saying, the cells, I know you want to learn about the cells. You're so excited about being in medical school and you're all little science nerds. But you know what? Those cells are in people, and those people are in families, and those families are in communities, and those communities are in populations, and those populations are in nations, and they're around the globe. So, I think that's the part where we had to think about how do you connect all that part of the curriculum. And so that's why, we always have kind of the lectures first about what is primary prevention, so they can start to apply that during the TBL, and also part of their readings. So great question. Anything else?
Well, during your presentation, you're describing this process of medical students who are learning. And I'm thinking about what is the role of physicians, doctors, in promoting environmental stewardship and also like climate change science in their careers as physicians. And we know that they are going to go into a context where they have 15 minutes to see a patient. Most of them will be asked to do that in 15 minutes, while there are so many issues that they have to address.
Right.
What do you think is the role that these med students that you're training will play?
Right. Yeah. And that's the part where we do address in a lot parts of our curriculum. We do want them to be able to make an accurate diagnosis and suggest the best treatment for their patients. But it doesn't stop there, because their patients have to get back and forth. What's their transportation? Do they have the money? Are they on insurance? Do they have any money to buy medicine? I just prescribed some medicine. Can they get it? Can they get their medicine and their food? So all of those issues we do. Now, climate change, you think about, that is really huge to be thinking about. Obviously, not every physician that comes out of the school will be advocates, but many will be thinking about, I need to be an advocate, and maybe my advocacy is on in reproductive justice and protection for women across the globe, or maybe my my advocacy is something else. Some of the students will be thinking about climate change. But no matter what they'll end up practicing, whether a neurosurgeon, or a family practitioner, climate change will hit them because they'll have to be thinking about, how their patient lives and what conditions that they live in. And so there are many people who I know. There's a great sessions that the VA has been doing with their doctors on a patient that comes in, a veteran comes in, the more humid weather, more hot weather, his asthma is out of control, and he doesn't have air conditioning. So what are we going to do about that? You could prescribe much more medicine, but unless you help his living conditions, so thinking about, maybe I need a prescription for an air conditioner for this guy. Thinking of kind of, those big social issues. So that obviously involves not just the physician. And so that's why we teach some multidisciplinary groups that will be working together. We also have to have the social worker and the nursing and the health educators and the community health workers all involved in helping this person to get their asthma under control and not end up in the hospital like they keep on doing. So those are the things that we picture that moving forward. Does that answer the question?
Yes, thank you very much. And we have a couple of other questions here in chat, and I know we have just a few minutes. First, I'd like to share a message from Ruth Epic, who says, "Brilliant presentation, thank you." And she's asking that we share our this webinar online, and we will do that as other seminars we've done too as well.
Okay.
You can find them in our website. We'll try to place the link for all of you so you can direct you. And by the end of the week, it should be in our website. But also, Tim Cheselsky asked, thank you for this excellent overview of this important transdisciplinary work. I love that you mentioned pollution writ large. I often wonder if what we already know about disease and suffering associated with mining and burning fossil fuels deserves more of our attention. For example, can we make partial solutions more obvious by emphasizing the well-described inequitable distributed ongoing damages from poor energy choices? And he provided a link as well. I don't know.
Yeah. Yes. Yeah, I see that. No, excellent points of this. Yeah, we need to keep, talking about those particulars and keep keeping that as part of the debate, obviously, and be thinking about the solutions. That's part of why, when we're thinking about communities, and Cleveland and Cuyahoga County are dedicated to continuing to work on climate change. Unfortunately, the U.S. left the Paris Agreement for a while. Mayors from around the country said, "No, we're still in the climate change. We're still in the Paris Accords, and we'll try to meet those goals." Cleveland was one of those. Our mayor was one of those that signed on. So we need to be talking about all of these and bringing that science to everyone. So that'd be great. So yeah.
Thank you so much. We have just maybe 1 more minute, but I'd like to ask you, could you give us a sense of what are potential next steps in the curriculum development at Case Western Reserve in the next?
Right. Funny you should ask. So no, so this was our first step, and we really so we've worked at previously of getting longitudinal, just general environmental health issues within the curriculum. And now we're going to start working on longitudinal. So within the first 2 years and probably the third year of getting topics specifically, not just environmental topics, but always very important. Thinking about air pollution, thinking about risk to workers, injuries and illnesses, but actually specific climate change topics that will link to some of the other teachings, some of the what's known as IQ cases, or the small cases that the students are presented with in the first 2 years, and hopefully in some of the cases in their third year cases, which is under another session called SAMI, the Science and Arts in Medicine Integrated. So great. We're planning that.
Well, thank you again to you and this great presentation. It's really encouraging to know that climate change topics are going into curriculum. So we wish that also for our pre-doctoral students. I would love to get you in our curriculum, a development team as well.
Yeah, yeah. We teach it for the MPH students, and we have a great new course being offered on just on climate change. I teach it in my environmental health course, but we have a new climate change course for the MPH students, but other graduate students would like to hear it. We'd love to have students sign up for it. So,
and I hope we will. And to all of you who have joined us like in this webinar, we thank you for your time, for your thoughtful questions as well. And we see names of like collaborators, and we are always encouraged to see you in the list of names, and be reminded of this synergy that can occur when we all collaborate in sharing knowledge. So
yes.
Thank you, everyone. Thank you, Dr. Mulloy, and we hope that you have a great day.
Yeah, thank you so much.